it looks like we're probably ready to start, Mark, when you are. So if you and Danny want to take it away, look forward to it.
Thank you very much. Unfortunately, Danny's not been able to actually join us today because he's actually up at the Nightingale Hospital trying to get them in a position where we're good to be able to return to normal work on Monday. So that's
right.
very, very unfortunate. But
well, that's a good excuse if ever there was one, Mark. So we'll forgive him.
Okay, that's brilliant. So if I can have sort of my first slide up, please, that would be brilliant. So we've been implementing the Leeds Improvement Method into Scan for Safety as a project, and we've faced a number of challenges in that. If I can have the next slide. The challenges that we've faced are Scan for Safety is a matrix management program, and that means that I have very few direct reporting staff. So lots of the ways in which you would traditionally work with Leeds Improvement Method have been very difficult to use. There has been no Scan for Safety team other than myself, so it's very difficult to have a conversation with yourself. Not impossible in the current times, but very difficult. And in February this year, we actually started taking staff on as we rolled the scheme out. And that's seen a real improvement in how you can actually use the Leeds Improvement Method. And we've faced a constant demand in Scan for Safety. We are constantly being asked, can we do this? Can we help with another area? Can we pick things up? And actually, those were the challenges that we were facing of, we'd got so much coming in, we'd not got time to develop, we'd not got breathing space, we'd got so many people involved. We constantly work with our stakeholders, and we'd a limited resource to do this. So if I can have the next slide, please. So what actions have we taken? Well, we have persevered and implemented the Leeds Improvement Method into such a small project and program environment, and it's had some real benefits. So we look at the inspiring innovation, and we use that when we create project terms of reference. So the start of everything we do, we can actually discuss with colleagues what we're looking at doing as a project, how we're going to work together, and then actually draw out the further thoughts through some of the methods. So the 5 whys, actually getting people to think about the mind valleys that we may fall into when we go into an area. We look at mapping things out properly when we start work, and actually the Leeds Improvement Method, we've adopted some of their standard work mapping to be able to actually map out what we're looking at, and that can either be a new design for a new system, or it can be actually thinking through the stages of a process logically. And that's brought some real benefits, not only to the trust here at Leeds, but to some of the work that we're doing with WIAT, where we've had the skills to be able to actually go in and map a process through. And then a real key to our departments is actually using the production boards and people link boards. And what I'd like to do is actually just go through how we're using some of these things with a few shots and talk through some of the work we're doing and where this is really impacting. So if I can have the next slide, please. So this is looking at the standard work that's going on in accident and emergency. And we've been given a request by the accident and emergency teams of, can we use Scan for Safety to track our patients through the departments, but also can we use it to track where we have space available? Because one of the challenges that the team faces, we have lots of patients moving very rapidly around a department, and trying to keep it up on top of a system that you have to go back into each time to move a patient is difficult for the team. So we looked at potentially using RFID tracking, and being able to use the standard worksheet and the process behind it has been really useful. So I've been able to split down what is information, where is a patient, what actually can we use to track, so global location numbers, where we can put things like, say, an RFID gateway if we went down RFID tracking. And the Leeds Improvement Method actually enabled me to have a method of drawing that out working it out in my own mind, and then improving it and communicating it to colleagues, because it went from well, we can sort of put a gateway here and a touch point here, to actually a visible system of being able to describe cubicles and spaces and physical space, and look at a process that goes backwards and forwards. We could then use that, if we actually started mapping out further, to use that as a basic worksheet for going, where do colleagues move backwards and forwards from? So that becomes a basis of a project, and that work is ongoing at present. If I can have my next slide, please. For some of our systems, we've actually looked at some of the challenges that we face, and we've then taken the standard work and made it electronic to make it easier to share with colleagues, especially in the new age where we're working far more digitally across the organisation. So this is an example of actually tracking barcode samples around histopathology. And it was really good to be able to sort of roughly draw it out, but then actually write it up in the stages, but then to pull out areas where we might be able to make an improvement, where we'd got real challenges to the organisation, or where we'd got a real point of actual learning that we can make a change and an advance in the system. And this works again ongoing, but actually having that ability to map out the process in a really clear format has helped. If I can have the next slide, please. Is it possible to get the next slide up? Okay, so what I want to go on now is from talking about, here are some of the examples of the kind of work and using those processes and following those through to actually some of our boards. I'm just hoping that the slide of our People Link board comes in. And this is where I'd hoped Danny would have been able to join us, because the People Link board I had set up as part of doing Lean for Leaders. And it was, I used it very briefly because I was effectively communicating with myself or writing notes for myself as to where we were up to, so that when I gave updates, I could speak to our executive sponsor, David Berridge, and go, right, here is an update on what we're doing. This is where we are. Here's where the plan is, and have it mapped out in front of me. What we actually ended up with was the ability to work as a team far better, and for me to introduce to Danny, a new member of the team, all the aspects of Scan for Safety work, but for him to also understand the mindset that we have in the team. So we start off actually with the 5 core values from the CQC. Is it safe? Is it effective? Is it responsive? Is it well led? Is it sustainable? Because actually, when we're introducing new technology, those really need to be at the forefront of our thoughts, that we don't rush into the latest glorified system. We then look at our own Leeds Way values and make sure that we're applying those at all times, and they sit above our People Link board. We also then link any work that we do back into the strategic goals and vision of the trust. I'm really hoping that this slide moves on, so that we can then split everything that we do across the work streams we've got back to the trust goals. And that's important to us, that we're fulfilling those goals. And we split everything down into various work streams with colour coordination, and we know which bits of work we've got coming up, so that anyone in the team can actually look and say, right, this is where we're working, and this is what we've got on the go. What are we working on? There we go. That's come up now. So you can see across the top the CQC, and we work sort of down the board. And once we get onto the board, we start moving across. So we've got major work that we're doing around patient tracking. So we know where the work is on life bed state, on being able to transfer patients using PPM Plus, and we know what's planned in the coming months. We have what we call COGS, which are cooperative operational groups, which is where we're implementing Scan for Safety in an area. So this is just our way of saying, right, this is a piece of work. These are the teams we're working with. What is happening with that work? So have we got things like a terms of reference set up for that work. We have the inventory management system. We're in the middle of starting to roll out a new inventory management system for the organisation that will give us far better data on a more frequent basis and allow us to gain some financial benefit in getting better reporting and better visibility of waste. And so we've got the plans in for pulling that through. And you can see as you look across the board, there are some small icons, and those icons are stickers that we can put on. So is the work that we're doing something that we're just needing to keep abreast of and just have information about? Is it actually our work, or is it something that somebody's asked us for an opinion on? And we can just put a very small icon next to it so that, again, we can visually see. And then at the end of the board, we have our everyday lean ideas. And I'm going to come on to everyday lean ideas towards the end of the presentation. And the check boxes at the end are just the schemes as they come in. They're just the basic structure to make sure that before we commit to a piece of work, have we understood what we're doing? Have we got the terms of reference? And has that gone to the Scan for Safety Programme Board? And so that gives us a real benefit to we know what we're doing and where we are. If I can have the next slide, please. From there, we move on to our production board. And these are our daily and weekly tasks that we need to do. It allows us to prioritize work. So we've got the work that we do with Scan for Safety. We have a work stream around finance, and then we have what we call ad hoc, and everything's split down into priority work, standard work, and then some nice to do items as well. And the nice to do stuff tends to sit at the bottom, but it is still a monthly goal to get at least one of those picked off, so that we're constantly improving the work we do. We have dials on there just so that we can have a rough gauge of what's actually under control, what's running really well, and if needs be, where do we need to focus some attention because actually things aren't going as well as they should be. At the bottom part of the board, we actually monitor the number of tasks that we've got coming into the department and then monitor the ones that have been completed and go out. And we run this as a KPI. And it's been actually really interesting to see that as Danny has come on board with our team, actually those numbers have gone up. So we are getting more work in, but also getting more work going out of the department as well. And there is a longer piece in Microsoft Teams now of actually tracking that data and showing it graphically. At the moment, we're supporting all the trust work that goes on with COVID around procurement. So we're actually using the board just to keep a log of the days that we're spending working on the COVID work as opposed to Scan for Safety, just so that we can report back to the board. And we do have a column there for if anybody's had to isolate. And luckily at the moment, that column is remaining blank. And I'm hoping that that will continue. We then monitor through here our communications visits. So which meetings have we got coming up? Where are we doing presentations? And where have, what else have we got committed? So that if anybody comes into the department and wants to know what visits we've got coming up, and one day when we can return to visits actually coming to site as opposed to online presentations, that becomes more and more important. We know that next week we've got a visit coming in and we know who's coming in. And those are updated and reviewed, and we keep signing off those dates. I wanted to finish by saying one of the big challenges are everyday lean ideas, because I kind of work on, or used to work as a project manager on my own without a team, and that was a real difficult area for me to actually implement. And we started recently with having more members of staff. And one of the things that my colleague Danny said to me was that actually we could do with a way of him knowing exactly what's in his task list, because we work in a very ad hoc way. And if I can have the next slide, please. We've actually turned to an electronic solution for this. So we have set up a Trello board that's linked into Microsoft Teams. And this allows us to actually put any incoming task. So if there's work that comes in, any member of the team can actually go in and add this to say, right, we need to do this work. We can then use Trello to actually manage that and assign it to a person, but we can also slide it up and down the priority list. So if something comes in that's more important, we can change our priorities. And this was worked out using an everyday lean idea. Why couldn't we get to managing workloads as efficiently as we wanted? Actually, we hadn't got a system to do it, was the initial thing. So we created the Trello system, and then we realized that we could link it in to Microsoft Teams and it all sit in one area so that people can look at the documents that we've got for Scan for Safety. They can look at their work, and then they can look at actually the work that they're doing. And I believe that sort of project management and the Leeds Improvement Method really do fit hand in hand. So if I can have my next slides, please. So the outcome of this is we've embedded the Leeds Improvement Method actually into the work that we're doing within the project environment. And it allows us to move from just simple project management to project leadership, because we can anticipate what's going on next, and we can improve where we're going, what we're doing, and we can start looking at the steps ahead a lot easier and a lot more visually. And then the everyday lean ideas become more and more important as the team expands and as we do more pieces of work. Those lean ideas can be picked up easily and worked on to improve not only the project we're working on, but anything else that comes out. So that's a sort of report out on what we've been doing within Scan for Safety.
That's great, Mark. Have you finished now?
Yeah.
Brilliant. Really good. I really enjoyed listening to that. I wanted to give colleagues the opportunity to quiz Mark and ask questions or make any comments. And I know we've got quite a few colleagues who've been listening to that, Mark. So let's open it up and perhaps explore some of the things that you've heard. So who'd like to kick off? If you could stick your hands up, that would be good, and I'll bring you in. That's great. I just had S. Is it S. Williams? Sorry. Oh, there you are, Sophie.
That's all right.
It's a lot easier when you see people's faces, isn't it? Yeah, go for it.
Thanks, Julian. Brilliant work, Mark. I think I've got a comment and a question, but it's brilliant to see how the daily management stuff's really supporting you, particularly through COVID and, any ad hoc work that comes through to you. I just wanted to ask, your really visual people link board, has that been made electronic, or are you still using that in the office?
We're still using that in the office because I'm not quite sure how to make that electronic yet. That's probably another challenge for me to actually add to the board and go, right, actually, how do we make the people link now electronic, and see where we go from there. That's a really good challenge, actually, because we are working across WIAT more often, and the more we can make something electronic, the more people can see it and see where we're up to. So I will accept that challenge and see if I can do something.
Great stuff.
Excellent. I like it. Very good. Other questions or comments for Mark? Well, I'll ask you a question then. What you mentioned Lean for Leaders and how you'd worked through that and applied that and so on. What just in terms of your own learning through all of this, because it feels the way it's come across, you've really embedded the Leeds Improvement Method in the whole approach on Scan for Safety, which is really good to see. But from your own point of view, what are the things that really stand out for you in terms of what you've learned and how you've applied some of that learning?
I think the real bit is on two fronts. There is a huge amount of learning about the Gemba, and that's been a real challenge because the Gemba for us isn't somewhere that we see. It's we go and help people in their own Gembas, and understanding that and understanding that any change we make, I really want to be involved right down at the bottom to work with people and work through the change that is going to happen. Has been really good. So we've done some work recently with neonatal teams about breast milk, and actually speaking to them about some of the problems they face actually revealed other parts of a system that we would need to bring out. So really understanding the Gemba has been really useful to me, that actually anything that we do, we need to be really involving all of our colleagues at every level that are going to impact on this system, and being hopefully over time more and more present in those areas.
Yeah.
And working with people, and then they actually just making things visual. How do we see what we're doing? Because it's really easy to just sit and write a report and fire that off. But how do we follow that up with, right, well, actually, here's what we're doing as a team. And I know one of the things that Danny said, he found the boards really useful when he moved into the department because it gave him a sense of scale. And he could see where we were going and what we were doing. So actually making things visual, and then actually having some tools that you can fit in with everything else that you do. So when we're answering questions, actually let's make things visual. When I'm sat in a meeting and people are discussing things, actually I'm not opposed to having great big sheets of paper across the desks and writing on them when we can get back together. Actually, this is what we're doing using whiteboards. I know one of the things Danny would say is that I've now gone so visual with anything. If you give me a surface that I can use a dry white marker on, I will. The idea of plastic screens around our office filled him with dread, because it was like, you will just write over anything. Just because I believe so much in making it visual. So
that's great. Really interesting, Mark, in terms of your observations both about the Gemba and the visual component of the Leeds Improvement Method certainly resonates. I'm also interested because you mentioned Wire, and of course we were pleased to obviously get the backing for taking Scan for Safety across other organisations and applying the benefits. In terms of how receptive would you say other organisations across Wire are to the principles behind the Leeds Improvement Method and the way that they themselves might be kind of rolling out and implementing Scan for Safety?
I think it's something that we kind of lead by example on, rather than say, oh, if you did this. So we're doing things at Leeds. So we make processes and changes, and we make things visual, and we make things as easy as they can be for the staff, and we work with the staff. And that in some ways becomes kind of, I hate to use the phrase at the moment, but infectious, that people can actually go out and go, right, actually, this is the way in which Leeds have modelled it. Actually, we can just take what we've done at Leeds and use it in our own way. And we do share everything that we can. So all the other trusts across the region can just take what we've done and learn from it. So one of the things we're using within the inventory management system, which is a very big piece of work, is we've got checklists within a system called monday.com, and that we will be able to export all the checklists and say, these are the steps we took, and very quickly pass that on to somebody else, or recommend that they actually use the same piece of software for their own teams. And I think carrying the principles forward and sort of having it ingrained in what we do sort of gives other organisations the opportunity to go, well, how do you know about this? So neonatal breast milk, we're looking at making safer and working with that as a region, and actually being able to do the mapping and show people, right, this is what it looks like. Everybody else was able to join in the discussions and add their parts in, because they could see it visually in front of them.
Absolutely. That's great to hear, not least because yesterday NHS England put forward the legislative changes that will put integrated care systems, ICSs, on a statutory footing. But a key part of that was a requirement for providers to work as part of a collaborative. And actually, much of that was based on Wyatt in terms of the approach. And fortunately, well, I think through our hard work and the great work that many of you have been part of, we've worked hard to make sure we in Leeds Teaching Hospitals have been looking out and working in partnership with our other trust colleagues in other parts of the region. And Wyatt's a really strong provider collaborative now that is able to roll out projects like Scan for Safety. So that's good to hear, and I think we can share more and more in that regard and learn from one another. So I'll just check if there are any final comments or questions for Mark. Can I just say that was great? I really enjoyed that. Please pass on my thanks to Danny as well.
I will do.
And great to see the work that's going on. Keep us up to date with what's happening on this. It is a really important project, and one that's making a real difference to safety, quality, efficiency, waste reduction, and so on, and many of the things you've taken us through, rooted in the way that you're doing it in the Leeds Improvement Method, which is fantastic. And particularly during this COVID period, it's great to see that work. So really well done.
Thank you.
Thank you, everyone, and look forward to seeing you at the next report out.